Hey there, future nurses! It's your boy, Nurse Blake here. Today we're diving into something super important, prioritizing nursing interventions. Trust me, this skill is going to be your best friend when you're out there saving lives. Imagine you're juggling 5 patients at once. Each one needs something different. Who do you help first? That's where prioritization comes in handy. It's all about figuring out what's most urgent and tackling that first. You gotta consider things like how stable the patient is, what could go wrong if you don't act fast, and what interventions will have the biggest impact. Remember, prioritization isn't just about doing things in order. It's about making smart choices that give your patients the best chance at getting better. So let's dive into some real-world scenarios and see how this works in action. All right, let's kick things off with some common scenarios you'll face as a nurse. First up, we've got a patient with pneumonia who's been prescribed oxygen therapy. What's the first thing you should do? Monitor oxygen saturation levels. If their levels are too low, you need to act fast. Next scenario, you've got a patient with heart failure showing some ankle edema. Your priority here? Administering those diuretics, baby. We need to get rid of that extra fluid ASAP. Remember, in both these cases, we're focusing on interventions that address the root cause of the problem. It's all about hitting the problem where it hurts, in a good way, of course. Now let's switch gears and talk about diabetes. You've got a patient who needs insulin Lispro. When do you give it? Right before meals, folks. This timing is crucial. Insulin Lispro is a rapid-acting insulin. It starts working fast, peaks quickly, and doesn't hang around long. By giving it right before meals, we're mimicking what a healthy pancreas would do. Moving on to our surgical scenario. You've got a patient who's about to go under the knife, and they're asking about their pre-op meds. What do you tell them? That it's to help them relax and reduce anxiety. Surgery is scary. By explaining the purpose of the meds, you're not just informing them, you're also helping to ease their fears. Good communication is just as important as any medication we give. Section 4. Prioritizing care in oncology and pain management. All right, let's talk about one of the toughest parts of nursing, caring for patients with cancer. You've got a patient on chemo who's feeling nauseous. What's your go-to move? Ondansetron, also known as Zofran, is your best friend here. This little wonder drug blocks those pesky serotonin receptors that cause nausea. If they're constantly feeling sick, they might not eat or drink enough, leading to dehydration and malnutrition. By tackling this symptom, we're improving their quality of life in a big way. Now, let's switch gears to pain management. You've got a patient who's just had surgery and they're in pain. Assess their pain level and give pain meds as ordered. By managing pain effectively, we're setting our patients up for a smoother recovery. Section 5. Mastering the art of nursing prioritization. All right, future nurses, we've covered a lot of ground today. The real skill is learning how to apply these prioritization principles to any situation you encounter. So how do you get better at prioritization? Practice, practice, practice. Every time you're in clinical, every time you're studying a case, ask yourself, what would I do first and why? Remember, prioritization isn't just about following a set of rules. It's about using your critical thinking skills and your nursing knowledge to make the best decisions for your patients. It's about looking at the big picture and understanding how all the pieces fit together. Finally, don't forget that prioritization is a team sport. Communicate with your colleagues, ask for help when you need it, and always be ready to lend a hand. Now go out there and show the world what amazing nurses you can be.